Well, the world seems to be grinding to a halt as efforts to contain COVID-19, the coronavirus, have halted major events and brought the economy to its knees. In our region, the major extent of the impact has been felt in cancellations and some confusion. But so far, no cases of the disease in our immediate area. Well, joining us now with the latest information is Ellen Hill. She's the Northeast Region District Epidemiologist for the Minnesota Department of Health. And Amy Westbrook is the Public Health Division Director for St. Louis County. And I want to thank both of you for being here today. I know you've had extremely busy weeks. And Ellen, let's just start with you and give us the current update. It's Friday, March 13th in the afternoon. Where does the state stand right now?
So right now the state stands at 14 cases. So far all the cases are south of us and no cases in counties that are neighboring sort of the 7-county Arrowhead region of northeastern Minnesota. The governor did have a press conference this afternoon at 1 o'clock where we announced our first round of community mitigation recommendations and guidelines for the state.
And what are some of those things that would fall into that first round?
So some of those first rounds, and I should also clarify too by saying that we're treating this, if you will, sort of as the dial on your volume dial on your stereo system. So we're trying to start out really taking into account where we're at with cases and transmission in the state. So far we have not identified a local in-state transmission. All of our cases so far have travel links either internationally or to other states in the country. But the first community mitigation measures we're recommending are really taking a close look at these larger gatherings, so 250 people or more in these gatherings, and really taking a hard look at do we really need to have these gatherings, and putting some guidelines out there for considering canceling some of those larger gatherings. And then looking at those gatherings that are less than 250 people and looking at the space these gatherings are going to be occurring. Is there enough space environmentally where people can maintain some distance from folks? What are the environmental controls within these facilities? And then looking also at gatherings of even like 10 or more, and with those gatherings, do you have a higher number of people who would be considered being in a high risk population for severe outcomes for getting an infection?
Amy, from the county standpoint, how well prepared do you feel like the county is if this epidemic does reach our area?
Well, we have been doing a lot of planning, especially that's true in the past years. We do have positions dedicated to public health emergency planning. So I feel like we're well prepared. The situation continues to change, so it's really hard to anticipate what will happen next. But we are working a lot with our community partners, making sure that there's open lines of communication with cities, towns, school districts, other important key stakeholders, and making sure that the information that's getting out is accurate and appropriate and timely, and making sure that we're a resource and that we're following the Minnesota Department of Health guidelines and CDC recommendations and taking our cues from the state primarily.
Now, in addition to the pandemic that's going on, we're also in the middle of what traditionally is our cold and flu season, where people kind of expect to get chills and fever and sniffles. And how does somebody know whether they're just experiencing the common cold and flu, or if they should be concerned and contact their health provider and get tested for the COVID-19?
So what we're recommending folks do is that if you're feeling at the point where, say this was the same time last year, are you feeling say it was last year, if you're feeling this bad, would you have contacted your healthcare provider at that point in time for care? And if you would have done that, then we are recommending that you do contact your healthcare provider at that point in time. If you have been notified that you have a known exposure to someone who's been diagnosed with COVID-19, and you're experiencing symptoms similar to influenza, then we would recommend that you definitely call your healthcare provider and mention your exposure history, and that you'd like to be tested if you would like to.
Amy, from the county standpoint, do you work with the local hospitals and clinics, and have you had some communication with them and how prepared they are for these situations?
Yeah, we have a really robust and active Northeast Healthcare Coalition, where we bring together EMS, healthcare systems, and public health, sort of the spectrum of healthcare, and just making sure that there is a system in place to coordinate supplies and resources and communication across healthcare systems and across those groups of agencies. So we do feel, and we're also as a county working across departmentally with our partners in corrections and the sheriff's office. So we recognize, we're a service agency, we're a public health and human services agency, and we want to make sure that we're doing what we can to protect our clients and as well as the general public.
Mm-hmm. As you work with some of these community partners, are you getting a sense that there are enough kits available in our region for what could be the potential need? And if not, how do you prioritize who gets the test and who doesn't?
Yeah, that's a good question. Right now, the guidelines for testing are still meeting certain criteria. It's not a blanket, like anybody who goes in would be recommended to be tested. I would defer to Ellen about lab capacity and the number of tests that are getting out and getting back into the Department of Health lab. So if she wants to take that question a little bit deeper.
Sure. So we don't have testing capacity immediately here in the region. The tests are being run right now at our state public health lab in Minnesota, and then there are also commercial labs that are coming online. One came on late last week, and then a couple others have come online this week as well. So clinicians can contact their laboratories within the facilities that they work in to figure out where the best lab would be to send specimens, but we are testing at our state public health lab here in Minnesota.
Mm-hmm.
And Ellen, we've got a graphic that shows some of the steps people should take to kind of protect themselves as far as if you're feeling a little ill, what you can do, and I think we'll put that up while you're talking about, I think it's the cough and the wash graphic.
Right. Yeah, so we really recommend that people are washing their hands, and definitely after you use the restroom, of course, but also just other regular times during the day. If you haven't washed them for a while, it's been an hour or more, you might consider it. After you, of course, blow your nose or cough, that kind of thing. We would also recommend that folks cough into their elbow, not into their hands. It's a great way to sort of prevent those germs and some of the spray from a cough or a sneeze from going anywhere. And then also, it's stay home when you're sick. We can't emphasize that enough. It's very, very important to stay home when you're sick. And I know we try and tell people about this on a regular basis every flu season. We're all very busy people, and we have a lot that we need to get to during the day, but it's really important. And the last thing I just would say is it's not too late to get your flu shot. We're still in influenza season.
One of the things that everybody is talking about right now is the runs that there have been in the stores on supplies like toilet paper, hand sanitizer, antibacterial wipes, things like that. Do either of your organizations have just some basic guidelines in terms of, maybe what people should be keeping on hand in their homes as kind of like a survival kit to get them through the worst of this, or to be prepared in case they would have to be quarantined for a while?
Sure. It is, this is a situation that not many of us, if any of us, have ever been in. So there is a certain level of high concern, I guess, with everyone. And I have heard there's been runs on toilet paper and that sort of thing. We do recommend that people have a good supply of medication in case they need to have that on hand and they're not able to get it. Food is a good thing to have on hand, extra food. Toilet paper is something that you should probably have on hand too.
But leave enough for everyone.
Yeah, don't stockpile too much. But those sort of essential resources that you need on a daily basis are important to make sure that you have a small stockpile of those resources.
Now, Ellen, we've just got a few minutes left, and I want to make sure we get to something that you and I talked about before the show earlier this week, and that is everything that we're doing to try to soften that bell curve of an epidemic. We have a graphic that goes with that as well, but that's the social distancing, the personal hygiene. Can you talk about that a little bit and how that can impact the extent of this epidemic?
Sure, yeah. So the bell curve that you're referring to and what many people on social media have seen is this idea of flattening the curve. And as you can see there, when there are no interventions, we have a really steep increase, a really very quick increase in the number of cases that are identified, the number of cases that are seeking medical attention. And whatever we can do personally and as a community to try and mitigate the spread of the disease really can help flatten out that bell curve. So your personal hygiene measures, washing your hands, covering your cough, staying home when you're sick, those are incredibly important. And then the community level interventions that we just started putting guidelines out for today. Those are really important too, to also start help flattening out that curve and to really try and spread it out. What we really want to do is we don't want to, as much as we can prevent it, overwhelm the healthcare system. We want people to be able to seek, if they need healthcare, we want them to be able to see somebody and get the care they need, and that's incredibly important.
Amy, of course, the county has been in the nursing home business. What about older people who, are maybe more susceptible or more vulnerable to the impacts of the virus? Should people stay away from visiting their loved ones? What are the guidelines there? You hate to leave your mom and dad without a visit, but at the same time, is it doing more harm than good to go there to see them?
Right. It's a tricky balance. You want to show you care and be close to your aging parents or grandparents. But it is important to make sure that if you do go and visit, you're really taking a lot of precautions in interacting with people, that you're washing your hands, doing all the things and that Ellen mentioned, but limiting your visits if it's not necessary. I mean, that is a vulnerable population for this virus. So that population specifically, we want to be very careful when we're interacting with them.
All right, well, we are unfortunately out of time, but I really appreciate your sharing all this information. Ellen Hill, Amy Westbrook, and good luck going forward.
Thank you.
Thank you.